What's up, YouTube? My name is Christian Brindle, and this is Medicare Empowerment. Everybody, thanks so much for joining me on episode 2 of Medicare Empowerment. For those of you who don't know me, my name is Christian Brindle. I'm an author of Medicare-centered books just like Medicare Guidance, Picking the Plan for You. I'm a host of the second, if not the most popular Medicare-centered podcast on the internet called the Everything Medicare Podcast. I own a company called Christian Brindle Insurance Services, where we work with people on their Medicare of all different situations in multiple different states. And today, folks, I want to bring you a topic on Medicare guidance that is dramatically important in my personal opinion. And that is, what's the difference between a Medicare Supplement and a Medicare Advantage plan? And it's a valid question. It's a question, if I had to guess, people always ask me, what is the most commonly asked question that you get from people on Medicare? And that might be it. That might be the number one question. If that's not it, it's, what's the best plan? That's why I'm losing my hair. Because Medicare is not a one-size-fits-all situation. Medicare is far from that. Medicare is something where it's specifically tailored to the person that's picking it, based on that specific person's needs and preferences. Okay? So, folks, today we're going to talk about what's the difference between Medicare Advantage and Medicare Supplements. Well, it's rather simple if you think about it. If you're getting on Medicare, maybe you're already on Medicare and you're just not sure what it is that you personally have, there's only two ways the person can go with their Medicare when you're picking up something individually in the marketplace. Now, this does not include retirement plans, group plans, work insurance, anything like that, okay? So just to preface my comments. But there's only two ways a person can go with their Medicare, okay? You have the Medicare Supplement side on this side, which would be a Medicare Supplement or Medigap program along with a Part D drug plan. And you have a Medicare Advantage plan on this side, okay, which is also known as Part C. Don't ask me why, but Medicare always comes up with more than one name for the same thing, okay? So what's the difference between a Medicare Advantage plan and a Medicare Supplement or vice versa? Well, let's just break down the two sides of which way you can go, all right? Let's start there. Because regardless of what you might have had as far as preconceived notions coming into this video, there's only two ways you can go with your Medicare, and everything you've ever heard about in regards to Medicare falls into one of these two columns. Okay, Medicare Supplements on this side again, Medicare Advantage on the other side. So that's right. That means Medicare Part A, Medicare Part B, Medicare Part C, Medicare Part D, Plan F, Plan G, Plan N. Everything you've ever heard about falls into these two categories. Falls into one of these two categories. And so in my opinion, if you can determine which way of the two ways you want to go with your Medicare, that takes out about 75% of the difficulty. And understanding the two ways you can go takes out probably 80% of the difficulty when it comes to making a selection and a decision. So we're going to jump right into that. So let's start with the Medicare Supplement side on this side, okay? Medicare Supplements are rather simple. The way Medicare Supplement works is it starts with you. You get your Medicare Parts A and Part B through the government. I did a whole episode on episode 1 on Medicare Empowerment about Part A and Part B. So go back and listen to that if you're just starting from scratch. But basically, you have your Medicare, okay, from the government. Medicare acts as your primary insurance for medical bills, hospitalizations, surgeries, doctor's appointments, because those are the things that Medicare covers. Medicare does not cover prescriptions, dental, vision, hearing, and there's a couple of things that Medicare doesn't cover in general that people need to be aware of. Like I said, go back and listen to episode 1 of Medicare Empowerment. But anyway, you have Medicare as your primary insurance from the government. Medicare Part A is no premium as long as you've worked in the country for at least 10 years of your life. Most people have. Medicare Part B costs $135.50 a month, as I talked to you about this. If you're in an income bracket that's mortal. If you're in a higher income bracket, they can charge you more for Part B. That's an episode for, that's a topic for another video. So you have your A and your B as your primary insurance. They typically will cover, they have deductibles and co-insurances, but for the most part, Medicare A and B pay 80% of your medical bills, and they leave 20% behind for you. So you have this 20% left behind. There's no limit to what that could be. So if you have a $100,000 hospital bill, chances are you'll end up with a $20,000 bill when you have just straight Medicare. So a supplement is through a private insurance company. They come in and they pay what Medicare does not pay. Between Medicare and between the supplement, you're probably going to be looking at full medical coverage, if not very close to it, depending on the plan that you pick. It's the best medical coverage that money can buy. Medicare supplements vary in price depending on your market, okay? But I'd say in most areas, you're probably looking at north of $100 a month. Most areas, okay? That takes care of your medical bills. The rules with a Medicare supplement is as long as Medicare pays first, the supplement will pay afterward. If Medicare doesn't pay for something, the supplement won't pay for something. So the supplement will only come in and pay the 20%. That's the purpose, that Medicare does not pay. It pays what Medicare leaves behind. So then you have something known as Part D that partners with a Medicare supplement, also through private insurance companies, and this is D, quite simple, D for drugs. Covers prescription coverage. So you have your Medicare Part A and B as your primary insurance, your Medicare supplement as your secondary insurance, your Part D plan for your drug coverage, and those are basically the three things. If you want dental vision hearing, you have to pick that stuff up separately. Again, a topic for a separate video. But you're probably going to look, depending on your market, this is going to vary. It could be more, it could be less, depending on where you live, but you're probably looking at anywhere between $250 a month to $300 a month in premium, assuming you pay the regular $135.50 for Medicare Part B. And I include that in your monthly premium because it's money that you're not getting. What is the good, the bad, and the ugly about a Medicare supplement? Well, in a nutshell, you have great medical coverage with a Medicare supplement. You have full medical coverage. You could have a $100,000 hospital bill and potentially not pay a penny or pay $100 depending on the type of plan you go with. So it's great medical coverage, number one. Number two is there's no networks with a Medicare supplement. As long as the doctor takes Medicare first, he will also take your Medicare supplement regardless of who it's through, what insurance company it's through. That's not just in the state you live in. That's nationwide. So it works the same in all 50 states. Nowadays, about 98% of doctors nationwide accept Medicare. Okay, so there's really no network, okay? The other thing is, Medicare supplements never change their benefits. They're going to be the same as far as the coverage is concerned year after year after year. So you don't have to update yourself on the coverage like you do with a Medicare Advantage plan, and I'll get to that in a moment. The other thing is you can't be canceled. They're guaranteed renewable. Once you have it, you can never lose it as long as you pay the premium. That's the one exception. So let's refresh. Great medical coverage, 1. No networks, 2. The coverage will never change, 3. And you can never be canceled, 4. Guaranteed renewable. That's the good. Now let's talk about the bad of a Medicare supplement. Well, the bad, I would say, would be it's more premium than a Medicare Advantage plan. It just is. It's a lot more premium in most cases. And I'll get to the Advantage in a second, like I mentioned. However, there's other bad things about a supplement other than this. A Medicare supplement doesn't cover any ancillary benefits, such as dental, vision, hearing. You typically have to pick that stuff up separately. It's a separate premium. But the biggest and most glaring negative that you need to know about a Medicare supplement is whatever price it is. Let's say it's $100 a month. Let's say it's $150 a month. It depends on where you live. But let's just say it's $100 a month for the sake of example. That's what it's going to be year one. Medicare supplements typically raise the prices every single year as you get older like clockwork. And they all do it. I don't care what anybody says. If anybody tells you that a Medicare supplement won't go up in price, they're a straight liar because they all do it. Some go up more than others. My job as a broker for someone is to find a plan that's going to go up as little as possible over a long period of time. So those are the good, the bad, the ugly of a Medicare supplement. Let's talk about Medicare Advantage now. With Medicare Advantage, it works something like this. It starts with you. You get your Medicare Parts A and B just like on the other side of the equation. But instead of running your Medicare through the government, you run your Medicare through a private insurance company. Okay? This private insurance company becomes your Medicare in a sense. It becomes your primary and in most cases your only insurance. That takes a big burden off of the government's shoulders, as you might imagine. They don't have to pay that 80% on your bills any longer. So, in exchange, Medicare funds whichever insurance company you pick every month to take care of you, and their funding varies on their star rating. Okay? So they get all this funding. Because of this, Medicare Advantage plans typically have very low premiums. In fact, in most cases, in a lot of markets, there's many plans that offer Medicare Advantage plans that are $0 premium, a donut. No premium at all. Okay? If they do have a premium, in most cases, you're probably looking at about a 20, 30, 40, maybe 50, worst case scenario, month premium. So what's the advantages and disadvantages? Well, with a Medicare Advantage plan, you have everything wrapped into one plan. So it comes with increased medical benefits on what Medicare would give you on its own. So the medical benefits work something like this. You typically have copays for everything. Think $5 to $10 to go to a primary care doctor. This depends on your market. Think $40 to $50 for a specialist visit. This depends on your market. Think $70 to $90 for an emergency room visit. Again, this depends on your market. You spend a couple nights in the hospital, they're probably going to charge you $200, $300, $400 a day in the hospital. Again, this depends on your market. But basically, copays for everything. And the medical coverage on its own is much better than Medicare would be by itself. Okay, better than that 20% would be. Okay, so the medical coverage is an increase, and potentially you're getting an increase without paying any premium for it, or not much premium for it. You have your drug coverage included. You don't have to pick it up separately. A lot of Medicare Advantage plans come with ancillary benefits, such as dental, vision, hearing, and amongst other things. They typically come and pay for a much wider diversity of things than Medicare would on its own. It's not so black and white. So, what's the good and the bad? Well, the good is it's much less premium. You pay the $135.50 for Part B. You can't get away from that regardless of what you do when you're on Medicare. But potentially that could be all you pay in premium. Or if you do pay a premium for your Medicare Advantage plan, it could be low, $20, $30 a month. The premiums are much lower. Okay. The other positive is you have everything wrapped into one plan. Your prescriptions coverage is included. You get extra coverage like dental, vision, hearing in a lot of cases. Depends on your market. That's a positive. Okay. And there's a convenience factor to it. You have everything wrapped into one plan. You don't really have to worry about having all these different cards for different things. Let's talk about the bad. Well, the bad things with Medicare Advantage are quite simple. You have exposure to paying more out of pocket with copays. You don't have full coverage like you do with a Medicare Supplement plan. Medicare Advantage plans also change their coverage dramatically year after year after year. They never stay the same. They fluctuate wildly up and down like a roller coaster. So if you're looking for something that's just going to stay the same forever, you don't want a Medicare Advantage plan. The other thing about Medicare Advantage plans is they do have networks of hospitals and doctors, and they require that you stay in their network. Now, this could be a good or a bad thing depending on the plan you're looking at. Some plans have dramatically huge networks where it's not as much of an issue. Some plans have very small networks to where it's very exclusive, and they're a big issue. It just depends on the plan. Okay? So, to refresh with a Medicare Advantage plan, the good would be lower premium, everything's in one plan, and there's a convenience factor. The bad would be they change every year dramatically, okay? They have networks. And I'd say another bad thing about Medicare Advantage plans is typically for medical bills, you'll get a lot of pre-authorization things that they need to approve, whereas with Medicare, you probably don't have that. Hope this helped, folks. Hope you understand this. Like I said, if you can master these two sides of the coin, it's going to help you out dramatically on making your decision. If you found this episode helpful, please drop a like on this video, subscribe for future videos, and drop a comment down below on what you'd like to see us talk about on a future episode of Medicare Empowerment. My name is Christian Brindle, and as always, folks, if you'd like to work with me and my organization on your Medicare, we work with all of the major, largest insurance companies in the Medicare industry. Our job is to sort through the options, find you the best choice based on your specific needs and preferences, and to help you with it. There's no cost, there's no obligation. It's the same price to do a plan with us as it would be directly through the insurance company, but you get year-round customer service and extra assistance when you work with us, a little bit more expertise. We work with people in the states of Utah, Florida, Idaho, and Oregon currently. If you live in one of those states, give us a call, 801-255-5340, 801-255-5340, Christian Brindle Insurance Services. You can also find our number down in the description. If you don't live in one of those 4 states, but you'd still like to get some of our expertise, check out our podcast, the Everything Medicare Podcast. That will also be down in the description, where we have an entire library about every question you could ever have about Medicare. You can get all the answers you need there. It's on every place podcasts can be heard. If that doesn't do it for you, though, you can always pick up a copy of my book, Medicare Guidance, Picking the Plan for You. It's an easy read. It's $5.50 currently on Amazon. For that price, we're practically giving it away. It's a 50-page book, big font. It's an easy read. Folks, insurance is an investment in yourself. Making the right decision opposed to making the wrong decision could cost you hundreds, maybe thousands, maybe even tens of thousands of dollars in premiums, not having something covered you need to be covered, not having your drugs covered properly, it's worth the investment in yourself. I encourage you to pick up the book, read it. You'll know more about Medicare than 95% of the population and probably more than your own agent. Thanks for watching. Have a great day, and until next time,